Hi, everyone. Thank you so much for joining us for another episode of Adam Interviews, where we are talking to folks in our community doing things of note. Our guest today is Anne-Marie Cook. She's with Lifespan, certainly fits that description, doing things of note in our community. Anne-Marie, thank you so much for joining us.
Thank you.
So Lifespan, by the way, for those who don't know, it basically helps with the needs of those in their senior years, but in a multitude of ways. Before we get into why we brought you here, why don't you quickly just talk about Lifespan and what you and the entire team do over there?
Absolutely. We help older adults take on both the challenges and the opportunities of longer life. At Lifespan, we have over 30 different programs and services, everything from older adult centers to social work services, to helping people with finances, and of course, helping people who have been scammed, just to name a few. So we serve about 30,000 older adults every single year.
It is tremendous. And so we called Anne-Marie because we reported yesterday about the Waterview Heights. It's a rehabilitation and nursing center in the city of Rochester, and it's going to close on August 25th. And there are around 200 residents who need a place to stay, which is terrifying to hear because you hear about these stories of people trying to get their parents or themselves into a nursing facility, and it's already hard. I mean, 200 people. What does this mean for our community?
Well, it's very challenging. There's no doubt about it. And many of these individuals are on Medicaid, which makes it even more challenging to place them somewhere else. But if you just look at this year in isolation, I think you would think, well, we can absorb that. The problem is last year we had several older adult residences close and different levels of care. And we have more or fewer beds now than we did 10 years ago, 15 years ago, but we have more older adults. So it will be a challenge to make sure these individuals have safe and appropriate housing going forward. And it's a short time frame. So we will all work, of course, to support the efforts of the home to place people appropriately and make sure people understand their options.
Absolutely. I mean, we talk about the issues over at, I think it was Northfield in Parenton,
That's right.
And then we had the Danforth and Hudson Ridge Towers in the city of Rochester with Family Service of Rochester. They lost their funding from the state and over very similar issues. And we had dozens there too. I mean, it just gets so hard. And I guess I think the state ended up placing some of those folks from the family services in one place out in Hilton or Hamlin.
Right.
Where do these folks go? I mean, where can they go?
Well, at Waterview, of course, they're even at a higher level of care. They're skilled nursing and nursing home level
Good
care.
point.
What I found in the past is that the long-term care communities certainly have stepped up and tried to help everybody so that they could be placed in the Rochester area so that their loved ones can continue to see them. That's what we're most concerned about, to make sure family can see those residents. It will be a challenge. Of course, Lifespan is working with the state and with the home to try to figure some of this out and identify free beds so that families have these options. But we're really in a long-term care crisis here. We see our hospitals backed up because there's not enough beds. We see facilities closing like we have in the last couple of years, and it's becoming a challenge.
There's no question about it. So who are the players involved here? When you say, they're working with you, but, who's at the center? Who's in the room trying to make this happen?
Of course, it's the responsibility of the facility. They will still get paid through Medicaid through September to make sure all these people receive the appropriate placement. So it is their responsibility. But it is the Lifespan Ombudsman Program as well as the state Department of Health working to make sure that these individuals are appropriately placed.
Anne-Marie, you mentioned that, it's a crisis. I don't disagree. How did we get here?
Well, I think it's a combination of issues. One, there's just more older adults. And certainly in our community, we're higher than the state average in terms of the number of older adults. So if you don't mind, I'm going to give you two stats.
Oh, we got time. This is what these interviews are for, so we can kind of go in depth on this stuff.
About 20% of New York State's population is over the age of 60, but in Monroe County, it's 25% and rapidly increasing from there. I think the other stat that's really telling is for by the time it's 2030, so really a few years away, we will have more older adults than children in this county for the first time in history.
Wow.
For the first time in history. So we're really seeing, as they are in many parts of the world, a huge demographic shift, unlike we've ever seen before. So you take in the numbers, you take in kind of the hit that I think a lot of long-term care places had during COVID, where they lost an enormous amount of staff that really never came back. And you talk about reimbursement rates. I think those combination of things, this confluence of issues, have caused right now a long-term care crisis.
Let me just ask you this, because at some point you say these numbers and I'm kind of blown away by it, and then you have a hit like a Westview. I mean, do any of them go homeless? Or I mean, what's the backstop here if there are quote unquote no beds left?
The backstop, and the hospitals will hate me saying this, is go to a hospital. If you're eligible
Yeah.
for a nursing home, quite frankly, you have limitations in which wouldn't allow you to go anywhere else. So there may be some people we can put services in and may be safe at home, but I'm going to tell you that's going to be few people.
Yeah. And look, you're absolutely right. That has been what a lot of people have had to do. I know that RRH and URMC through Strong, they've had bed issues for a long time. And that was only exacerbated by the COVID pandemic. But this has been building for a long time. And so they're caring for people that really should be in a nursing home, correct?
No question about it. When you even talk to any of the hospitals, they probably are housing 30 to 40 people
Yeah.
that should be in nursing homes at the appropriate level of care, rather than acute care bed setting, in which we need those beds for acute care. So there's a domino effect here.
That's it. That's
Whenever
the right
nursing
term.
homes beds close, it's a huge domino that affects all of us, regardless of age.
Yeah, let's talk about, so people can understand what that domino is. So if you create more nursing home beds out there, it relieves the hospitals and they have more beds and resources to care for people coming in, which then betters the entire community because they're healthier. They can respond better to a health crisis. So really at the core of it, it's the nursing home beds, as far as I can tell.
It's a huge part of it. That's the nursing home beds. Of course, when you look at history here in Rochester, we also had a couple of hospitals close years and years ago, St. Mary's and Genesee. Many people may not even remember those hospitals.
don't.
I certainly do, Adam. I'm
Yeah.
older than you are. But I think we have, first of all, fewer hospital beds in our community than they do in some communities. So that's a problem. And then, of course, the nursing home situation really, really is troubling for acute care.
Absolutely. So, we're going to talk about solutions, and just one thing comes to mind, and, maybe it's just more societal, and I don't even know if this is kind of a myth, but you look like, let's say in Europe and things like that, or a few decades ago, the parents would move in with their children and things like that. Is that where we're starting to go, or is that part of the solution, is to kind of get back to that old pattern of kind of multifamily dwellings?
It's certainly part of the solution. I'm telling you, it's happening now.
Is that?
And we help
Yeah.
caregivers all the time that are really struggling
Yeah.
with full-time work, caring for children, caring for their parents, and really not only the just pressure of all of that, the financial pressure is real too. So we have people in our community, quite frankly, doing extraordinary things to care for their parents. It's just not appropriate for everybody, though. And so I think we have to say we need strong, good nursing homes here to take care of those very complex older adults or people with disabilities who need that kind of care.
So when you talk about supporting the caregivers, what does that support look like from Lifespan and perhaps other organizations and government agencies?
No question. I mean, we help caregivers all the time understand their resources, understand benefits that their parents may be eligible for and apply for those benefits, understanding various diseases. So we run a lot of classes with the Alzheimer's Association of Rochester about dementia. What can you expect? Those types of things all help caregivers, I think, build a plan. And that's what we do for them, build a plan so they can care for their loved one appropriately.
What, a complete side note here, but you and your team have to come across some very difficult situations and you see some very hard things. How do you handle that kind of trauma.
It is trauma for the staff, and so we're always very sensitive to that trauma, and it's very difficult to work with people that are at a crisis point in their life all day. When you take these calls, we have a call center with 8 people on the phones all the time, where people are calling with their crisis, their situation. The staff is incredibly trained. I just very fortunate that Lifespan has such a good staff of people that work with people all the time, understand their situations, and really are able to de-escalate situations so that they can talk about what needs to be done, what care plan needs to be developed for the older adult, instead of a lot of extraneous things.
Absolutely. So I was reading, this is my first day reporting on Waterview. Dawson Levan did the reporting yesterday. But it appears from what I've read over the years, this is not a surprise to anyone. Waterview has had issues in the past, if you want to talk about that.
Waterview has had issues for a long time. That the State Department of Health has been in there for a long time. I actually wasn't surprised that it closed because they've had so many issues, but I was disappointed that those issues couldn't be resolved.
Especially because you already have everybody there. And, one thing that I kind of hit me from covering the Hudson Ridge Danforth Towers issue is that even though they might only be there for 6 months, a year, this is a home to them.
It is absolutely their home.
So why don't you talk about, it's one thing to say, oh, we'll get you in a place that has similar services if they can, but it's still extraordinarily disruptive to move like that, right?
No question about it. And, this becomes their home. This is where they live. This is where their routine is. And for many people, of course, the routine is so important, especially those individuals with dementia. So you begin moving people around, changing the routine, changing people that they see each day. That has a huge impact on their lives and a huge impact on their families' lives because they're used to seeing their loved one at certain times.
Especially, I was thinking when they moved the residents from, let's say, Hudson Ridge to Hilton, I mean, family members might not have the means to get out to the other
That's
place.
right. And unfortunately, we saw people even move further and heard from a lot of family
really?
members that have said they're never going to be able to see their loved one again. And of course, we try to help with that transportation problem. But let's face it, if you move to Hornell or you move to Dansville and you live in the city of Rochester and don't have a car there, it's going to be really hard to get out there.
So when I hear about this shortage, you think, well, it's supply and demand. There's a huge demand out there. Could some entrepreneur or some nonprofit simply create more space, more beds for these folks that would immediately fill up? And so that's not happening. So clearly something is preventing that. What is it at this point?
Well, it's an easy answer, but a hard way to fix it. It's money. I mean, long-term care is expensive.
Yeah.
In our community, you're going to pay about $18,000 a month.
A month.
A month. And even if you have resources, even if you have significant resources, think of how fast those resources will deplete.
Right.
So the vast majority of people in long-term care are on Medicaid. And Medicaid rate doesn't pay the full cost for these nursing homes of what the services they have to provide every day. You will hear that from administrators and you'll hear that from owners all the time. So while the supply is there, the demand is there rather.
Right.
The supply isn't there because it doesn't make sense financially.
We're hearing about cuts coming from DC. Does this apply to this part of Medicaid? I mean, are we going to see less money coming in through New York State? How does this work?
I'm not sure yet, Adam. Certainly, we're going to see Medicaid cuts for those individuals who have community Medicaid. And we've already seen issues in people calling because the essential plan has changed. And it's very difficult for people who receive full health care coverage now that have to pay, and they may not be able to. And I suspect with the Medicaid changes that will become January, we will see more cuts to community-based Medicaid, which will ultimately impact, I'm sure, long-term care Medicaid.
So help me understand, because I actually don't know the difference. When you talk about community Medicaid, What are you saying that's different from?
Well, there's a lot of folks who live in our community who own their own homes but don't make enough money to have health insurance because of their jobs or it's not
Hmm.
offered for their job, and they're eligible for Medicaid. So eligible for a health insurance plan very similar to what you and I may have.
Right.
Chronic care Medicaid or long-term care Medicaid is for those individuals who reside in a nursing home.
I see. So that's it. It's different than if someone were living alone but getting Medicaid.
Correct.
Okay. And then as far as living alone, I know a lot of seniors like that. The independence of it. Are there resources to help them if they can't do everything that they used to do?
The answer is yes, absolutely. And call Lifespan. We'd be happy to help connect people to services. But I will say, services in the community aren't perfect either anymore. There's a lot of shortages there, but we do the best we can. And this is where family comes in so important to fill in those gaps when paid care can't do that.
Yeah. And by the way, and this almost goes outside of the money issue. We have some family friends who I thought was very interesting. They are still young, if you will. They have their health and they've have their house that they've been living in for, I don't know, 40, 50 years, something like that. And they decided to move into a senior living facility. And so it's one that has a lot of independent living. I mean, it's basically someone that comes in and just helps a little bit, not even medically, but they wanted to kind of get in the door. I thought was interesting. And then kind of being pragmatic about how life is and how the human body is, kind of then move to the different stages. And they didn't want to have a tragedy force that. And then suddenly the whole family's scrambling for a spot. Your thought on that kind of approach?
It's wonderful, and there's a lot of people in our community and a lot of places here that have every level of care, independent, assisted living, and then all the way to nursing home care. Now, for some people that can't afford it. So if you can do it, it's a wonderful approach. People love it, I have to say, and we help people understand their options there all the time. But it's not for everybody because there is a cost associated with it.
Huge. Yeah, you're absolutely right. And I find myself asking this way too much in interviews, but the fact is it's becoming a bigger part of our life by the day. But when it comes to AI, robotics, things like that, from the Lifespan perspective, are you getting newsletters? Are you seeing it more in conferences? Are they talking about the role that all of that might play in the coming years?
We certainly are seeing it and how it may be beneficial in so many ways. Of course, Adam, we're also dealing with the downside of that. We're seeing more and more people scammed through AI scams. So I have to say,
Of course.
I'm worried. And right at Lifespan alone, and we only deal with so many cases. We have seen people lose millions of dollars this year right from Monroe County, right from our community. So we're always on the bandwagon saying, be careful. Call us if you don't think you want to check something out, because we've just seen too many people lose so much money.
Yeah, and I know you and I have talked about that, and it's terrifying how real some of this stuff looks. And you and I might be susceptible, but someone who has not stayed technically inclined or in the know, it's so easy now because it looks real, it sounds real, and everything like that. So the other day I was at RIT and I saw a robot mower mowing the lawn there. I mean, is this going to be incorporated in nursing homes, things like that, whether it's maintaining sanitation on the floors, things like, I mean, or is this kind of still pie in the sky years from now type of stuff?
I don't think it's pie in the sky at all. And as a matter of fact, a lot of times I look at what other countries are doing, because while I say we're aging here, other countries, Japan, certainly Europe, are far ahead of us in terms of their aging population.
Oh, that's interesting.
And so Japan uses robots a lot. Now, I think it's a different culture, a different acceptance, but I'm always looking at how well they do with even home, in the home robots to help people. And certainly there's other countries that are far ahead of us in terms of their use of robotics or AI or technology. And I think it's right around the corner here.
What about companionship? That kind of weirds me out. I'm not going to lie.
It weirds me out too, but I'm going to tell you, in Japan, people really love the robot. And so, I know there was a movie years ago about it, and I often think, but, loneliness and isolation is a huge issue for older adults.
Right.
And for some, these robots are taking the place of a human.
Yeah. If it helps, it helps. I'm not going to sit here and argue, whatever that is. So if you had a magic wand right now, outside of just, creating rooms, but actual practical wand, convincing people to do this or that, what's the magic bullet here to help solve this in the coming years?
Well, I think part of it, and we focus on this a lot, is having people focus more on their health span rather than their lifespan. And there's a lot of simple ways people can do to make sure that they're healthier. And we look at those years in which people are spending 20 years with chronic conditions, and what can you do? Small things you can do to make sure you're healthier so you can stay in the community for as long as possible. Now, again, it's not for, at some point people may need long-term care, but, there are things folks can do. So we emphasize those things. I hope, too, that there's more funding available, quite frankly, so that we can begin to look at different levels of care and making sure there's appropriate staffing at those levels of care. We're always looking at that. And certainly we want everybody to stay in the community for as long as possible. So we're hoping that we can somehow get increased reimbursement for home care and make sure people can get a little bit of care at home and stay there longer.
So we so often talk about reimbursement and funding, and at the same time, you have half of the voting population wanting lower taxes, limited government. So if that is not an option, do you turn to philanthropy? Do you turn to other means of funding?
I think the answer is yes to all, although I don't see philanthropy being able to fill the entire gap of this. And I think at some point, the government has to look at the realities of a changing demographic population and change those policies, change some policies about the realities of just we're an aging society. And I'm not sure that has happened yet.
Yeah, and also, the thing is, wherever the funding comes from, again, going back to that domino effect that you were talking about, you can say, well, not my problem, or I've earned enough money to make sure that I'm taken care of. But if you get sent to the hospital and there's not room for you, if they're overwhelmed, that does impact you. It could impact a loved one who might get into a car crash or something like that. So this is one of those issues where it's really hard to put it in a silo and say, I don't have to worry about that.
That's right. And it's happening today. I get several calls a week from people saying my loved one was in the emergency room for over 24 hours.
All the time.
And there's not much I can say other than I'm sure that they're trying to find your loved one a bed.
Mm-hmm. Yeah, exactly. And the thing is, too, sometimes I try to remind myself that although, you're from Lifespan and we talk about senior living, but a lot of these facilities also tend to those with just general disabilities, and they might be on the younger side.
No question about it. There's certain nursing homes, certainly, that really cater to those individuals, people with disabilities, and they need that level of care. There's no question about it. And it's the exact same issue, exact same problem.
If people do want to get support from Lifespan, they want to learn more, where can they go about getting that, Anne Marie?
You certainly can call 585-244-8400 or hop on our website, lifespanrochester.org.
All right. Well, thank you so much for your time. Anything that you'd like to add that I might have missed? I feel like we covered a lot of ground, but there's a lot more ground, I'm sure, that could be covered. So anything that you'd like to add before we take off here? No,
the only thing I wanted to add was I hope this is the last nursing home that closes in our area and that we can figure out appropriate housing for all older adults.
Hear, hear. From your lips to their ears. Thank you so much, Anne Marie Cook from Lifespan. We really appreciate the insight that you always provide and provided today.
Thank you very much.
Of course, Anne Marie Cook, again, from Lifespan. Please reach out if you have any issues, not just for yourself, but for loved ones as well. It's not just about getting you to someplace, but also getting resources to you, which is really what they specialize in, along with so much else. So thank you so much for joining us for another episode of Adam Interviews. We hope that you can watch the others that we've done and also the other content on this app. If you talk with friends and family, please tell them about this app so they can download it onto their smart TV and join you in the cool kids crowd. All right, everyone, take care, and we'll talk soon.
Get the Rochester First streaming app today for everything you love from News 8 On Demand, plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.